So today we will be talking about Metvix Daylight Activated Field Therapy. Now this is actually a topical chemotherapy agent, a cream that we use on precancerous cells called actinic keratosis and very thin superficial basal cell cancers as well as squamous cell cancers. Now the reason why we call it field therapy is it's a field of area that we are trying to treat. It's typically an area that is too large that we're going to do surgery on, so this is why we are treating a whole field of area. The benefits about this medication is the fact that the speed of treatment is really fast, especially if you want to do more than one cycle. It's much faster than our more conventional type of topical chemotherapy agents like Efidex or Zyclera. Also much less side effects. A lot of patients, typically if they use topical or if they've used topical chemotherapy agents in the past, they would immediately tell you that it's really rough treatments with a lot of side effects. As I've said, the nice thing about Metvix is that it is highly selective. It only responds to precancerous and cancerous cells. It doesn't do anything to normal skin. So again, when you do the treatment, you will immediately see that it's got this blotchy appearance because it doesn't respond to normal skin. So what we do is when we approach this treatment, we would like to prime the skin. And how we do that is there's different agents that we can use to chemically try to descale the skin as much as possible. I always use the analogy to say that a precancer and a cancer is almost like a turtle. It hides under the scale, and the idea is that we want to descale the precancerous and cancerous lesion as much as we can so that the penetration of the medication is as good as possible. So typically what we would do 3 to 10 days before the treatment, we will recommend a form of descaling treatment. And there's several descaling protocols that we have, and we will tailor that specifically to your skin type as well as the amount of damage and precancers or cancers that you have on your skin. You will do this treatment typically 3 to 10 days prior to coming to our office. And then on the day that you would come to our office, we don't want you to have anything on your skin. So no sunscreens or moisturizers. So literally normal skin without anything on it. What we would do then is we will put sunscreen on your skin. Now that is going to be a chemical sunscreen. The reason why we can't use a physical or a mineral-based sunscreen is that the daylight will be reflected away from the skin. So it needs to be a chemical sunscreen. We will put it on the area that we will treat, and then we will let it soak in for about 10 to 15 minutes. Then one of the nurses will come in and they will manually use a curette to descale the skin or scrape the skin to again manually get rid of as much as possible of the excess scale that was not removed by the priming agents previously or the days before the treatment, and we will manually remove that dead skin and scales even more. This process is luckily not painful. After that, we will apply then the Metvix cream or the medication. Again, luckily, there's no pain associated with applying this medication. Sometimes a little bit of tingling sensation, but most patients don't experience any form of discomfort when this medication is applied. After that, we then want you to go outside into daylight for 2 hours or 120 minutes. If you live out of town, we will ask that you actually would walk around here, maybe go to the beach, and then be outside for 2 hours. If you live close by, you can definitely go home, and then as soon as you get home, you will be outside for 2 hours to expose the skin to daylight. Now, the important factor here is it's daylight. Doesn't need to be sunshine. So this medication will work even if it's overcast. And the most important factor for activating this medication is actually temperature. So we need temperatures to be above 10 to 12 degrees, and then of course we just need daylight. So don't be afraid if it is over cloud, that's not a problem. After the 2 hours that you've been outside, then we want you to wash off the medication. We will give you some products that you will use to wash it off. And then we will also give you a prescription for a topical steroid that we want you to use that will also help with just making the experience more comfortable. After the treatment, typically your skin will feel a little bit red, a little bit irritated. Sometimes you can get some itchiness, some swelling. In rare cases, you can actually get some ulcerations, bleeding from the skin, but that is typically quite rare, and we will regularly check in with you to see how you are doing after the treatment. Then, depending on the amount of cycles that you're going to do, typically we will have a 7 to 10 day period in between the cycles that we do of Metvix. After your last treatment, then we wait typically 6 weeks before you will follow up with me again, and then we will review the skin, examine the skin, and see if there's anything else that was not addressed with this treatment. Now, to remember, this medication only responds to abnormal cells, precancerous and cancerous cells, which means that if it is a normal, let's say a mole or a seborrheic keratosis, some of my patients call them the barnacles of wisdom, nothing is going to happen. Remember, those guys are going to stay because, again, they're not precancerous or cancerous cells. And then at your 6-week visit, we will review the area, we'll have a look and see if there's anything else that we have to do.